Just ahead on Being Well, we're talking about our medicine cabinet with pharmacist Tom Hembermehl of Paris. Tom will be here to talk about over-the-counter medications, drug interactions, how to get rid of expired medications, and a whole lot more. That's coming up, so don't go away. Well, if you're from the Paris area, you probably know this gentleman very well, Tom Hembermehl, longtime pharmacist in Paris. How long you've retired? Tell us a little bit about your practice.
I've been there for 44.5 years. I've earned the right to retire, and I look forward to spending more time with the people in the community that we have served for years.
Okay, well, let's talk about, as a pharmacist, you guys have a broad knowledge of information. What are the sorts of things that people should be talking to their pharmacist about?
Well, we get questions on anything and everything, and I guess that's one of the important things. We are trusted. We're trusted as a knowledgeable source of information, and I have to agree with that. Plus, we're free.
That's true.
You can't call your doctor, you can't call your attorney and get free information, but you can sure walk in or call and talk with your pharmacist. That's why we're theoretically the most respected profession. Free advice.
So what are the scope of questions that pharmacists can usually handle?
Well, just like a general practitioner, pharmacists get orders from everywhere, dealing with specialties and just general type of healthcare issues. Therefore, the questions we get are just completely across the board.
Okay, not just always related to the medication that they're picking up that day.
You're right, because it goes much further than that. We have to be a knowledgeable source of information to be able to say, I can't help you with that. You need to go to the specialist, or you need to see your physician. In other words, our most appropriate answer sometimes is to say no.
Okay.
But we are the clearinghouse, so people can go further for additional information.
Okay. Well, let's talk about you were 40 years as a pharmacist. What are some of the most common questions that people have for you?
Well, we do have questions on how do I take this. Oh, one of the big ones, can I have a drink with this?
Like a drink of alcohol?
Yes.
Okay.
And quite honestly, there are very few medications where you absolutely cannot, should not. But in a number of situations, it's encouraged to improve circulation, and there is no negative problem with the medication.
Okay.
So people are not afraid to ask that question.
If I can down this with a glass of wine.
There you go. Yeah. And if it makes you feel better, of course, the benefits of wine, these are all compounded.
What are some other things that people often ask?
We have a lot of questions about their children.
Okay.
Pediatric doses. And that gets to be a tough issue sometimes because we don't know either the child's age or their body weight or their overall health condition. And that's one of the big problems too. We have a lot of phone calls from people we don't know. They got their medication elsewhere and they call us for advice. And that's a real touchy one too. Ma'am, I'm trying to help you, but I'm limited. In the future, I'd be glad to serve you, and we can do a better job for you.
Okay. Well, let's talk about our medicine cabinet. What are some of the things that you'd recommend for people that they should have at home? You know, medications certainly expire, but what are some things that we need to have in case of, at-home emergencies?
The first thing, most people just need to clear out their medicine cabinet.
Okay.
There's old stuff in there. There's stuff they don't know why they even had it. So it's important to clear out old stuff. But then your question was, what do you put in there? And that depends upon the age of the individual, the number of people in the family. Are there young children? Are we talking an older couple? So that's a tough one to answer, but the basic things. And don't put more than you have to in there. Stuff gets old.
It does.
Even Band-Aids get old.
Yes, they get all sticky and you can't peel them off. We're going to talk a little later in the show about how to, get rid of medications. But I want to talk about a common thing that a lot of people use, over-the-counter pain relievers. What is best for what? Because we've got acetaminophen, we've got NSAIDs, we've got, okay, what's best for a headache?
That's another one of those tough ones to answer,
Okay.
because if I don't know your health history,
Okay.
and again, that's why people come to a pharmacist, and that's good. If I know them, I can say, because of what you're taking or the condition that I know you have, we need to consider Tylenol or acetaminophen, or we can move into the NSAIDs. And for those people that don't know what an NSAID is, these are the non-steroid, non-cortisone anti-inflammatories.
Okay.
Aleve, Motrin, things of this, and Advil, things like that.
So those are for inflammation. So what does really acetaminophen do? Is that better as a pain reliever?
It is the most popular pain reliever. In fact, has created a big problem because people take just handfuls of acetaminophen. The problem is there is a limit on how much you can safely take before it affects your liver.
Okay.
In fact, that total was 4 grams a day. Now they have backed that down to no more than 3 grams a day.
Which is about how many pills?
Well, if you're taking an extra strength acetaminophen, that would be no more than 6 a day. Before it was 8 a day. And there are people that take considerably more than that. So acetaminophen is an excellent pain reliever and fever reducer.
Okay.
It does nothing for the inflammation.
Okay.
So if you are talking about an injury or an arthritic type of pain, logically we would do an NSAID and acetaminophen.
Okay.
You're getting the pain benefit from the NSAID along with the anti-inflammatory effect, and then here comes the straight pain relief from the acetaminophen.
Okay, I'm going to throw another one in there. Then what is like naproxen sodium, which is like the Aleve? That's something completely different.
Nope, that is an NSAID.
Okay.
Yes, yeah. Naproxen, under the brand name Aleve, and this is confusing for people. You know, we deal with this every day of the week, so it's a no-brainer for us.
Right.
But when you hear ibuprofen and, as you mentioned, naproxen, and there are others, then people start to get confused. And that's where we also have a lot of questions. Can I take this with that? And, well, yes, you can. Or, in some rare conditions, no. Thank you for calling us. No, you should not do that.
So it all depends. There is not one answer that works for every person.
And in fact, that's a big issue when people are looking at the shelf. You can tell that they don't know what they need. They are looking at a brand name that they recognize, and yes, advertising sells, but they're trying to select the most appropriate thing when in fact they should just go right up to the pharmacist first, and then we can say, this is it, or that, or this combination, but nothing else.
Okay. So, you know, cold and flu season comes around, and just like you said, there are lots of advertisements on TV, and there's a lot of stuff. There's pills, there's liquids. How do you even know what to, you know, do you go, well, I have a runny nose and a scratchy throat, and look for the medication that takes care of those?
Okay, well, this is a real problem with your cough and cold preparations because, okay, let's use the example of the Tylenol family. It used to have 84 combinations of things, sizes and additional products. Now it's over 100, well over 100, because Tylenol with the pain, you know, this is good for cold, fever, congestion, cough, all this stuff because they're adding these additional ingredients. Right. Well, people are reading those boxes on the shelf saying, oh, well, that's me. And so they grab that. There's a problem with that because the symptoms today may not be the symptoms in 2 more days. In other words, you may not need that antihistamine. It'll overdry. Again, that's where you should just come right up to the pharmacist and say, here are my symptoms. Here's what I'm having a problem with. What do you recommend?
Right. So
many times I'll say, you need an antihistamine, but no more than 5 days of it. Because it'll end up over drying and you can't get the congestion out. So There are no pat answers.
So if you're looking at a box that cures maybe is supposed to take care of 5 symptoms and you only have 2, it's not really a good idea to say, well, I'll take that because then it'll kind of take care of everything.
Take care of everything, and that's the way a lot of people think, and that's the way these products are made to sell. Oh, if I'm covering all of these symptoms, I'll sell more of that product, and that is not necessarily good.
So it's perfectly acceptable, you know, even if you're at the pharmacy and you're not getting a prescription, it's okay to come to the pharmacist and say, hey, I'm looking for an over-the-counter.
And in fact, we appreciate it when people come and say, please help me, I have this problem.
Okay.
Rather than, I know they're floundering over there, but I'll wait until they come to talk to me.
Okay. Okay. Well, let's talk about that. Just because something is over the counter and you can buy it, too much of it can be a bad thing. What are some medications that can be actually dangerous if you take too much?
Great question, because people think over the counter, and doctors think this too, over the counter items are safe. I do not agree. And a classic example is Benadryl. Benadryl should be on prescription status simply because it has so much drowsiness associated with it. That's why it's the ingredient in all the sleep aids.
Right.
Gee, maybe that ought to tell you something right there. But people will say, oh, I need some Benadryl. The doctor said, oh, I've got this symptom, a rash or whatever. Take some Benadryl, and then they drive and they literally fall asleep on the road. So you're talking about adults that are unintentionally impaired.
Yeah.
So Benadryl is a product I never recommend. Short-acting, major drowsiness. To me, it's a worthless product.
Okay. And if you could easily overdose on that as like a sleep aid and maybe
Absolutely.
not wake up.
And you have this mindset, oh, boxes take 1 or 2. Well,
3 might be better.
3 might be better than that, and 4 is the best. Yeah.
Yeah,
That's typical men, unfortunately.
Yeah, we tend to think if 1's better, then 4 must be twice.
That's exactly the way people think.
All right, so let's talk real quick about giving adult over-the-counters to children. Is it safe to go, well, I'll just cut the pill in half because the child is so much smaller than me?
Well, dosing is a big issue, and whether it's a pill that you cut in half or, again, you're guessing, because almost every one of those medicines that's under the age of 6, ask your physician.
Right.
And that's good because, well, one, it's legal protection from that for that manufacturer so they don't get in trouble. But the other thing is you don't really know the appropriate dose for a child under the age of 6 because body weight is so different. Again, you talk to the pharmacist, we can work through that. Unless we have a real issue with a youngster that's very sick, multiple issues, that's when we say, you better talk with your doctor first.
Okay, so let's move on to prescriptions. And I bet you see this a lot. Someone gets an antibiotic or maybe a nice prescription painkiller and they think, oh, I'm just maybe gonna save this for later on. How do you address that?
Well, this is a typical mindset too, especially if it costs money.
Right.
Yes, if it's an expensive one, I'm going to take all that I think I need, but I'm sure going to save this for later. And that can be a big problem. One rule of thumb is take the medicine until it's gone. And the reason, the symptoms are improving and you feel really good with like 2 more days left of the antibiotic. But if you don't take those remaining 2 days, we're not completely over the infection, we're over the symptoms.
Right.
But we need to complete it to make sure that the issue is behind us. And then again, if you save a 2-day supply of an antibiotic, what good is that going to do? It's just going to kickstart your treatment. You'll be out of the medicine. Then what do you do? Because the doctor will say, well, wait a minute, you were self-medicating. I'm not sure what to use. I can't culture it. So we're trying to outsmart, and it creates big problems.
Yeah, and I think I probably have done this myself. I don't anymore, but you know, say you go have a tooth extracted and you get that really good Tylenol with codeine, and you think, oh, I'm going to save a little bit of that because I might be injured later. Or share it with somebody else. Well, not a good idea.
And in fact, this is a huge problem that we have where either adult medicine is shared by, among adults, or a potent pain reliever is sitting on a shelf And the kids are saying, wait, Mom has this order for Vicodin, and I know there's some guys who would like to have that.
Yeah.
And this happens a lot because adults drop their guard. I'm not needing it. It's in the cabinet. I'm not going to worry about it, but I know if I need it, there it is. Uh-oh, all of a sudden it's gone.
Okay, yeah, so that, because we do hear more and more about prescription drug abuse, and we've seen public service announcements for kids raiding the medicine cabinet, taking it to school.
And people are just not paying attention to the possibility of that happening in their house. It always happens to the other. Yes, exactly.
Right. Are there common, maybe with antibiotics, or are there certain drug interactions or things that we shouldn't take if we're taking a prescription drug? You probably shouldn't, that make it less effective, maybe a food or other over-the-counter drugs that can interact with prescription drugs?
Okay, well, this is why we went to school for so many years. Prescription medications in themselves, there are all kinds of interactions with others. So that's important for the pharmacist to be able to screen that. And in fact, we're learning more and more about some of these things. You can't keep it all straight in your head, but there's a cross-check through the computer.
Okay.
So it does an initial signal. Then once we are alerted, we'll do a little studying to see if it's an issue that we should be aware of or not. But it goes much further than that. So we've talked about 2 prescription medications. Oh, but over-the-counter items. Now there is no talking between these 2 categories because they're not being used through the computer in the pharmacy. Then you have herbals, and then you have foods. Okay, now we have a huge bailiwick here. And what do we do when somebody calls us? I'm not feeling well, and I'm taking this medicine. Ma'am, we need to talk about a number of things.
Everything.
Everything that you're doing. Yeah.
Okay, so be very open with your pharmacist, your doctor, about everything you're taking, even if it's
and that is so important, but nobody does that.
Yeah.
Now, that brings up another very important issue. Everybody goes to multiple physicians. One specialist here, one specialist there. Yes, I have a family physician, but not everybody communicates. You have to stay with one pharmacy so that all of those things are cleared through one pharmacy, so we can say, oh, wait a minute, doctor's prescribing this, but I'll bet you he is not aware that the other physician prescribed that, and we have a problem and we need to talk with both of them. Now, if I filled one medication and the chain store down the street filled the other,
you don't
Nobody knows. Nobody knows.
Okay. I bet you see that a lot in some of your older customers who just have a lot of medications.
That and the problem of mail order.
Oh, okay.
Oh, I didn't know you were getting that by mail order. You didn't tell me. Now we have a problem with this combination.
Okay. So be very aware and be very open about what all you're taking.
So, otherwise, I can't do a good job as a pharmacist.
So you had said earlier, so we were talking about having, stocking our medicine cabinet. You said the first thing you need to do is go through and get rid of your old stuff. How do you get rid of it? How should you get rid of old aspirins? And
people typically would just dump it down the toilet, and that was a good, safe way to get rid of things. The only trouble, that goes right into the city water supply, which is either dumped into, well, in our community, it's a large lake.
Right.
But the lake has been destroyed environmentally, ecologically, because of medications and other stuff that goes in there.
Right.
But now they're saying, if you have medicine to destroy it, if you don't know what to do with it, take it to your pharmacist.
Okay.
He'll destroy it. Take it to the police department or the jail or the sheriff or whoever does a control here, and they will pool this, and then they do a group destruction. In fact, we have a great program going on in Paris where there is a medication disposition.
Right.
And on a given Saturday, you drive through and either you throw the bottle in this big bucket and the sheriff is standing right there screening it, and this is good. Yeah, this is really good. Or if you have a number of things, put them in a bag, but everything is destroyed then the proper way by the sheriff. Now, instead of dumping things down the toilet, what would you do if you have a few remaining pills in the bottle? One thing we suggest doing is dump it in your trash, but dump it so it's spread all around. That way, if somebody is dumpster diving, they may find one pill, but they're not going to find a bottle full. So if you have to dispose of it yourself, that's a safe and effective way to do it. Or you can go out and bury it in your backyard, dig a little hole and dump the pills in. Of course, your neighbors will look at you a little
like,
strange.
what are you burying?
Well, yeah, you're fertilizing it.
So like medications, when they expire, generally they are losing their effectiveness? Or can they become hazardous? Or?
Well, yes, that's a very good question, because when things are put on the market, or excuse me, manufactured and put on the shelf, they do have an expiration date. Generally, it's no more than 3 years. This is an arbitrary thing. So if somebody says, I've opened this bottle or excuse me, this prescription, and I got it 3 years ago, I'll be able to look at the shelf and say, you're right at the edge of expiration, don't take it, or don't worry about it, because I know that is good for an additional length of time. Remember, this country used to take outdated medications and then they'd ship them to third world countries. So that right there says they're safe. They're still essentially fully effective, or nearly so. But if something stays in your shelf or in your cabinet for a length of time, and it's exposed to heat and humidity, as bathrooms are, things do change. So if you have a pill that looks like there's a color change or a breakdown of the nice hard form, that's a firm message, dispose of it.
Okay.
And yes, if things do stay on the shelf for a long period of time, they can mutate.
Okay.
And it's unpredictable.
Yeah, so better safe than sorry. Clean it out. It's hard to sometimes get rid of something that you paid good money for that you only took one of, but...
But here's another issue. If you look at the bottle, and I always label medicine so that it says, take as needed for whatever the condition is. So many bottles on the shelf, 1 every 4 hours as needed. As needed for what? So people will be searching for something on their shelf and they all say as needed, but they have no idea for what, so dispose of those.
All right, well, our time here went very fast. Thank you for coming on the show and sharing some good information about what we need to be doing with our over-the-counter and prescription drugs. Tom, good luck in the retirement. We will have to have you back again now that you've got all this free time.
Well, my time is not free,
okay.
But I do appreciate the invitation to be on, so I can communicate the important things people need to know about their medicines.
All right, thank you.
Thank you.